Hello and welcome to another episode of TheLiverDoc. I am Dr. Abby Phillips. I am a liver disease specialist and today we'll be talking about cirrhosis in plain, simple language. So before I start, let me show you a prescription. So this prescription is from an Ayurvedic practitioner who was treating a patient with cirrhosis. And you can actually see there are 32 herbal drugs given for management of cirrhosis as per this prescription. Not only that, a host of other activities were done on this patient, including herbal oil massages on the abdomen, herbal oil enemas, herbal oil installation into the nose, and a host of other activities. So is this the way that we have to treat cirrhosis? So for that, you have to know what cirrhosis is. Welcome to this episode of TheLiverDoc, where we discuss what cirrhosis is and how we deal with it scientifically and what the role of Ayurveda is. Let's go. If you read the classical textbooks in medicine, real medicine, they would say cirrhosis is an irreversible change to structure of the liver, whereby there are two stages, where in the first stages there is only structural changes and features associated with it, and in later stages you will have to deal with the complications. So before we look at cirrhosis per se, what leads to cirrhosis? So if you look at a normal liver, which is soft and functioning well, that liver has the ability to regenerate. So if you have a normal liver and you have an acute insult, that is an insult or an injury that comes and goes, that liver has the power to regenerate and take care of that insult. So this is what happens to, or what happened to Prometheus in the mythical story, where he stole the fire and the gods cursed him and chained him on a rock. And every night a vulture would come and eat out his liver, only to find that the liver has grown back the next day, and the vulture keeps doing that to him. So that was eternal hell for him. So liver is the only organ that can do that, which can regenerate so fast. So if you cut off one part of the liver, the other part grows to take care of the functions of the body. It is such a wonderful organ. So we have to do everything to protect it. But what if we keep insulting the liver with a particular injury? An example is alcohol, continuous alcohol use, or hepatitis B, chronic hepatitis B virus, chronic hepatitis C virus, or even fatty liver disease because of obesity or diabetes. So once these injuries are prolonged or chronic, then the liver actually starts losing its ability to regenerate well. So the injury leads to inflammation, which is basically swelling of the liver cells, and the liver cell starts dying, and because the injury is ongoing, the liver ability to regenerate is lost and scarring happens. So the scarring is what we call as fibrosis. Now fibrosis is of various stages. So this is all happening before the cirrhosis happens. So the stage of fibrosis starts from F0, where there is no fibrosis, and to F1, where there is minimal fibrosis, to F2, where there is early fibrosis, to F3, where there is advanced fibrosis, and F4, where there is cirrhosis. So stage of fibrosis F4 is considered as cirrhosis. Now inside cirrhosis, there are 5 stages. So that is cirrhosis stage 1, 2, 3, 4 and 5. In cirrhosis stage 1, you'll have features of cirrhosis. For example, you'll have a small shrunken liver. You will have a change in the liver structure or the texture. You will have some changes or dark complexion of the skin. Patients will have a little bit of swelling of the legs. So these are features of cirrhosis. These are not complications of cirrhosis. That happens in stage 1. In stage 2, as the liver shrinks because of the ongoing insult and because of the loss of regenerative power, the liver keeps shrinking. And as the liver shrinks, the pressure inside the liver increases. This is known as portal hypertension. Portal hypertension is named because the pressure inside a specific blood vessel inside the liver actually increases, and that blood vessel is known as portal vein. So once you have a high pressure built inside the portal vein, patients develop portal hypertension, and patients start developing features of portal hypertension, and that is in stage 2. So what are the features of portal hypertension? There are basically two things. One is that development of varices. So varices means there are large blood vessels that are formed inside the food pipe, in the stomach, in other parts of the gastrointestinal tract, that is in the other parts of the abdomen. And these blood vessels become engorged because of the high liver pressure. These are known as varices. The second finding of portal hypertension is something known as splenomegaly. So this organ known as the spleen, it starts enlarging because the pressure inside the liver rises. And the third is complications associated with portal hypertension, and that happens in stage 3 and stage 4 of cirrhosis. So now we have cirrhosis, features of cirrhosis, and because the liver pressure increases, you'll have features of cirrhosis with portal hypertension, that is increase in liver pressure. Now in third stage, patients start developing clinical complications of portal hypertension, which is collection of fluid inside the abdomen, which is medically known as ascites. So once ascites develop, patients develop abdominal bloating, they start gaining weight, they become swollen, and that is when sometimes you will have to put in a needle and take out fluid from the abdomen. A lot of patients come in this stage actually initially. In the fourth stage, patients have ascites, but more importantly, they start bleeding. So we spoke about varices previously, where there are large blood vessels in the food pipe and in the stomach. When the liver pressure rises suddenly, these blood vessels burst open and patients start vomiting blood, or the collected blood goes out in the stool as dark stool. This is known as melena or black tarry stools. So these are features of bleeding in cirrhosis. So in third stage and fourth stage, you start developing complications of portal hypertension. Now there is another stage which I think we all should be aware of and we all should be concerned about, and that is stage 5. So in stage 5, patients actually develop multiple complications of cirrhosis. For example, they have ascites, that is fluid buildup, they have bleeding, they develop infections, they develop jaundice. This is when jaundice happens, that is stage 5 of cirrhosis. And the onset of jaundice actually means that the patient is started to develop liver failure. And once this progresses, another major event happens, and this is known as hepatic encephalopathy or brain failure in cirrhosis. So when the function of the liver becomes so bad as to develop jaundice and repeated infections, the handling of toxins inside the body also becomes lesser because of a poor liver function. Because the liver is the seat of all detoxification. So here is what we say: you don't detoxify the liver detoxifies you. The liver is what detoxifies you. You don't detoxify the liver. So anybody who comes and tells you that there is a detox or a liver cleanse, the only thing that they're going to do is to detox you of your bank balance and cleanse your wallet of your money. So once the detoxifying capacity is lost, patients start developing toxins, accumulating toxins inside their blood, and most important toxin of that is ammonia. Ammonia reaches the brain and patients start developing brain failure in the form of possibly a host of problems like inability to identify family members, slurring of speech, confusion, and that can actually lead to even coma. This is known as hepatic encephalopathy. So you have cirrhosis patients going from stage 1 to stage 5, and in stage 5 they develop liver failure, and once liver failure develops, the only way out is to go for a transplant. But you have to identify patients in the stages before that, and there is a lot that you can do for these patients. So once the patient develops portal hypertension, that is high liver pressures in stage 3 or in stage 2, the need for treatment in that stage is to reduce the liver pressures, and that is why we use a drug known as beta blocker. The commonly used drugs are carvedilol and propranolol. Some even use a drug known as nadolol. So beta blockers are a class of drugs that can actually reduce the liver pressures and prevent complications of portal hypertension. Now, if a patient develops bleed along with fluid accumulation in the abdomen, then the role of endoscopic therapies come in there. Because a bleeding patient, we have to first control the bleed. So that is why a bleeder undergoes endoscopy and something known as variceal banding or ligation, where the bleeding vessels are identified and a band is put over it and the bleeding stops. And then these patients are continued on beta blockers, and repeated sessions of banding. Most of these patients require somewhere around 2 to 4 sessions of banding to completely eradicate those bleeding vessels inside the food pipe and the stomach. So we have a patient who is on beta blockers to reduce liver pressures, and if a patient is bleeding, then we start the patient on endoscopic therapy to control bleed, and then repeat endoscopic sessions until the bleeding vessels are all, the sources are all eradicated. Now what happens if a patient develops fluid in the abdomen, that is ascites? So the number one step in that is to restrict salt. So that is why we tell cirrhosis patients to restrict salt once they enter into stage 3 and 4. So restricting salt reduces liver pressure, and that actually reduces the complications associated with portal hypertension. Now how much of salt can one have? So this is a big question, and this is an important question because once you reduce salt, the patients start reducing their food intake, and this is not good. So the dictum is to allow 5 grams of salt a day, but in actual clinical practice, especially in Indian patients, we have seen that even allowing 5 grams of salt will actually worsen complications associated with high liver pressure. So in such patients, we advise them to reduce salt as much as they can so that food intake is not hampered. Then we start them on something known as diuretics. So diuretic therapy. So we have drugs known as furosemide, we have drugs known as torsemide, we have spironolactone. So these are the drugs that we use to clear the extra fluid buildup in the body through the urine. So the patient needs to have good kidney functions, and you start these drugs, the fluid will vanish through the urine and patients will dry out. And then you restrict salt, continue your liver pressure reducing medications and follow them up. So this is how you manage stage 3 and stage 4. Now some patients can have recurrence of these complications. For example, they can have recurrence of ascites, recurrence of bleeding, and they don't do well on medical management alone. Some of them even require repeated sessions of endoscopy to control bleed. Some of them have uncontrolled bleeds. Some of them have repeated tapping from the abdomen to remove the fluid, and their quality of life is poor. So in such patients, there is another way. So what we do is we directly go and reduce the liver pressure, and this technique is known as TIPS. That is transjugular intrahepatic portosystemic shunt placement. It is simple, it's a long term, but to simplify it, it's just putting a stent inside the liver. Just like what we do for heart blocks, where we do an angioplasty and put in a stent to clear the block. We do this for the liver patients also, where we put in a stent within the liver between 2 blood vessels and reduce the liver pressure, completely abolish or eradicate portal hypertension, and these patients will have complete absence of varices, that is those bleeding blood vessels, and complete absence of ascites, that is fluid buildup in the body. So this is what we can do for patients with cirrhosis with complications of high liver pressure not controlled by medications. That is something known as TIPS procedure. And TIPS procedure ensures that these patients remain stable for a very long time until at some point they develop stage 5. So stage 5 cirrhosis is quite difficult to manage medically, because what we do for these patients is to control their complications, improve their quality of life, and ultimately, if they are willing and family supportive, go in for a liver transplantation which will cure them of the liver failure. So this is how you manage stages of cirrhosis. So these are the stages of cirrhosis and how you manage cirrhosis as per the stage. In stage 1 and stage 2, you control the cause of cirrhosis. That is, those who take alcohol should stop consuming alcohol, take medications for hepatitis B and hepatitis C virus, lose weight, and a host of other liver diseases causes you control. And controlling the etiology, that is the cause of liver disease, actually arrests the progression of liver disease, that is cirrhosis, towards the later stages. So there are a lot of patients who have actually lost weight, stopped drinking, controlled their diabetes, and living very long lives, decades and decades, without any progression of their cirrhosis. This is possible. Just because it is structurally bad or structurally changed doesn't mean that that is the end of life, because you have to preserve the function of a cirrhotic liver, and the best way is to stop whatever is harming the liver. And the second is to provide exactly what the patient needs as per the stage of cirrhosis. Treat the liver pressure, treat the complications due to liver pressure, and then treat the liver failure and complications due to liver failure. When everything else fails, and this takes decades and decades for somebody to reach stage 5, go in for liver transplantation. But a lot of patients are led astray. They are not told regarding the actual management from scientific point of view, from stage-wise point of view. So such patients are the ones who unnecessarily consume medicines that they don't require for that particular stage, or they go for alternative therapies which have absolutely no role in managing any of the complications or the causes for those complications in cirrhosis. For example, what drug in Ayurveda actually can reduce portal hypertension? What drug in Ayurveda can reduce ascites? What drug in Ayurveda can help control a bleed? What drug in Ayurveda can help prevent a bleed? What drug in Ayurveda can prevent infections in cirrhosis? And what drug in Ayurveda can prevent failure, that is liver failure in cirrhosis? If you go and search the internet, valid scientific databases, you will see that there is none. There is no role of herbal medicines in treatment of cirrhosis. There is no role of massages. There is no role of herbal enemas. There is no role of herbal oil installation into the nose. None of these will actually prevent the cause of cirrhosis or reduce the cause of cirrhosis, that is causing the injury to the liver. None of this will reduce the liver pressures. None of this will prevent a bleed in cirrhosis, and none of this will prevent liver failure. So coming back to my patient who was on 32 herbal drugs for cirrhosis, he jumped within 6 to 7 months. He jumped from stage 2 to stage 5. He developed kidney injury, severe ascites requiring almost 8 to 9 liters of fluid removal almost every week, and he became emaciated because Ayurveda has this issue of stopping nutrition. So they say certain foods are not good for your body, so they stop a lot of proteins. Patients become emaciated, they develop infections, and then they become worse. So right now this patient is actually undergoing a lot of rehabilitation therapy, a lot of optimization, and ultimately he is going to go for a liver transplant. So a liver transplant that had to actually happen decades later happened within a few months in this particular patient because of the wrong treatment given. So what is the role of Ayurveda in treating a cirrhosis patient? Absolutely none. Why? Because there is no evidence that any ancient medical textbooks, so-called medical textbooks, or any ancient medications are useful for preventing or treating complications of cirrhosis. And most importantly, this is the most important part, the illusion of knowledge is far worse than ignorance. The illusion of knowledge is far worse than ignorance. So if somebody has the knowledge, the ideal, real scientific knowledge to treat a patient of cirrhosis, the first aspect is to do no harm. That is what a real doctor does, do no harm. So if you have an illusion of knowledge, you don't have that aspect of do no harm because you think whatever you're doing is right. So somebody hears cirrhosis, that is not the end of it. There is so much that we can do for that particular person. First is to identify the stage that he is in and then treat according to the stage. So if he is in early stages of cirrhosis, in stage 1 and 2, you treat for the cause of cirrhosis or abolish the cause of cirrhosis and treat for high liver pressures. And in stage 3 and 4, you actually direct your treatments to control complications of high liver pressure. And in stage 5, you go and chase the liver failure, control complications due to liver failure. So one should not be afraid of cirrhosis, because if cirrhosis gives you challenges, we will provide solutions. And science can give you the solutions to these problems. So I hope this episode was an eye-opener for all of you, simplified from understanding cirrhosis and its management stage-wise. I'll see you for the next episode. Until then, this is the LiverDoc signing off.